MRI stands for magnetic resonance imaging. We take pictures of the body's internal organs by the use of this machine. We can show nerves, muscles, bones, tissues in detail so the doctor could see what's causing the patient's ailment. MRI does not involve any radiation, so we'll be able to image patients even if they're pregnant, even if they're very young, unlike X-ray and CAT scan where they're limited to whom they can do studies on. Later on, I'll be showing you some images of what we see in our examination, and then I'll let you hear what it sounds like inside the MRI room, and then Gloria will demonstrate how strong the magnetic field is inside the MRI field. This is our control room. This is where we operate the magnet, and this is where we operate the automatic injector. And I'm going to show you how it sounds like inside the machine. And this is how it sounds like when we do a test. So that's the sound that the patient will hear for around 15 minutes to an hour or two. So now I'm going to show you some images of some anatomical parts that we do. And by the way, we do this test to be able to diagnose cancer, to show inflammation, to show injuries to bone or muscles, to show tears in muscles. This is an example of a knee, which we slice from side to side very thinly so we can see details of the bones, the muscle, the cartilage, the blood vessels. Here's an example of a brain. You do brain studies to be able to diagnose strokes or tumors in the brain or blood. And here's an example of a spine. So we can do scans on the brain, the spine, the abdomen, the chest, the joints, the long bones. And each test would last about 15 minutes to an hour or two. About me, I am from the Philippines. I've been doing MRI since 1991. And I've been doing this job for the past 30 plus years. What inspired me to do MRI is my interest in anatomy, and I'll be able to see what's going on with the patient's body to be able to diagnose a patient's ailment. It's an interesting field because every year something new comes up. And by the way, in college, here in the US, it will take 2 years in X-ray school and 1 year in MRI training, or you can do on-the-job training depending on what facility you're working. So if you're interested in going into the medical field of imaging, straight up out of high school, go to X-ray school, and then from there you can decide which field you want to focus on, either CAT scan, MRI, ultrasound, nuclear medicine, special procedures. There's a lot of choices, and it's a very rewarding career. The advice I would give to anyone considering this field is stay focused on your studies. It involves a lot of sciences, especially anatomy, biology, mathematics, physics. And if you do well, it won't be a problem for you to be one of us. Our next scene will be in a room where Gloria will show you the equipment in a magnet room. It's called a magnet room because that's where we have the strong magnet, which is about 10,000 times stronger than the Earth's gravity. So we're very careful of bringing things into the magnet room because anything with iron in it could fly into the magnet room that could damage it or injure a patient. So the magnet room is a very restricted area. All patients who goes into the room has to be screened properly to make sure they don't have any metallic implants, no pacemakers, no shrapnel or fragments in the body, and they get to be scanned for metal. And if they're clear, then you can open the door and let them in. Now Gloria will show us the equipment to be used inside the magnet room.
So once inside the MRI room, we will lay the patient down on this table. This, for example, is the coil that we use for brain imaging. Patient will lay down. This actually comes apart. Patient's head will be positioned in this area. We will position the patient's head in this area. Then we will bring this part of the coil as a top portion, as a helmet. And then the table slides in. We will center the anatomy with this red light, zero it in, and slide the table in. Okay, so just to make it a little more fun and easier to understand, I'm going to show you more or less the strength of the magnet. I have two regular tennis balls, and what we've done is we've cut one of them in half, and we've put some metal pieces in it, a couple of screws inside, and then the other one has nothing. It's just a regular tennis ball. So I'm going to bounce this ball, the regular one, towards the magnet, okay? So I'll do this. And then if I were to do the same thing with the tennis ball that has the metal inside, I'm going to bounce it towards the machine. And immediately it's going to get sucked in by the magnet.
So this is what we do. It's a lot of fun and it's very rewarding.
If you have any questions or any curiosity as to joining the imaging field, there are many resources out there that can help you and can guide you into becoming part of this health field. It is very rewarding. There are lots of opportunities to move up, to learn more. It is also exciting to be able to help others and to assist the doctors in diagnosing different ailments that a patient can have.
Thank you for viewing. And remember, if you're one of us, you'll be the doctor's eyes.